Welcome to our presentation on how social media is negatively impacting the society around us. Throughout this presentation, we will be explaining the main effects of social media towards the society, which are anxiety and depression, addiction, cyberbullying and online harassment, and body image and self-esteem. How is social media affecting depression and anxiety? Social media is contributing to depression and anxiety in many ways, such as social comparison, where people are comparing themselves to edited and idealized lives they see online, which is lowering their self esteem. Another way is through the fear of missing out, where people are seeing others having fun or achieving success online, and it's making them feel left out or inadequate. Another way is through sleep disruption, um, as sleep quality is directly related to mental health, and mental health is directly related to anxiety and depression. And finally, through seeking validation, people who are posting online can begin to start relying on likes, comments, and followers for self worth. And once they don't achieve these likes, comments, and followers, disappointment sets in because their expectations are not met. Social media's effect on newer generations. Kids that are developing alongside social media are showing increased rates of depression, anxiety, and poor self esteem. Social media is encouraging unhealthy comparisons. Teens are constantly exposed to edited photos and unrealistic lifestyles, which can make them feel unhappy with their own lives. This, combined with cyberbullying, online pressure, and reduced face to face interaction, is making social media one of the biggest mental health challenges for young people today.
How social media can influence our behavior and why it can sometimes become difficult to put our phones down. Social media can create addictive habits because it triggers dopamine, a brain chemical linked to reward and pleasure. Likes, notifications, comments, and streaks make users feel good and encourage them to keep checking their phones. Features like endless scrolling and personalized algorithms keep people engaged for longer than intended. Over time, some users become dependent on social media and feel the need to constantly check their phones, influencing their daily habits and behaviors. Social media is a big part of everyday life for many people. While it has many benefits, it can also create challenges when used too much. Social media can affect our focus and relationships. Many platforms use short videos and quick posts that keep people constantly entertained. Because we get used to quick short videos, it can be harder to pay attention to activities that take more time, such as listening in class, reading, or doing homework. Some people also become less patient and more easily distracted. Social media can also affect daily life and relationships. Spending too much time online may reduce face to face communication with friends and family. It can also take time away from hobbies, sports, and other activities. Although social media helps people stay connected, some users still feel lonely even when they interact online. As a result, too much social media use can affect both concentration and real world relationships. The impact on sleep and mental exhaustion. Another way social media can affect people is through sleep and mental exhaustion. Many people use their phones right before bed, but this can negatively affect sleep quality. The blue light from screens reduces the production of melatonin, a hormone that helps us fall asleep. As a result, it can take longer to fall asleep, and people may not get enough rest. Poor sleep can then lead to mental exhaustion. People may experience increased fatigue, irritability, and stress throughout the day. Lack of sleep can also make it harder to focus in school, which may lead to lower grades. Over time, these effects can contribute to anxiety and other mental health challenges. This shows how too much social media use can impact both physical and mental well being.
So, what is cyberbullying? Cyberbullying is the act of targeting, threatening, and harassing people online. Another form of cyberbullying could be sharing explicit, non consensual images of other people. Cyberbullying is most prominent on social media apps such as Snapchat, Instagram, and Facebook, and is a leading contributor to suicides in young children and teens. How does cyberbullying affect the victim? Cyberbullying can affect one's health in ways such as developing severe anxiety and/or depression, suicidal thoughts, thoughts about self-harm, and social exclusion, which can lead to social anxiety disorder. People are targeted every day by these online bullies, and people from all around the world are suffering from it. What are the criminal offenses of cyberbullying? Although there is no specific cyberbullying offense, there are laws put in place to bring these people to justice. These laws include non-consensual image sharing, criminal harassment, and uttering threats. These crimes can get you up to 10 years in prison, along with hefty fines. So how can we solve this issue? One way would be to enforce a ban on social media for children under 16. Countries such as Australia are starting to do this. Australia has enforced this law as of December 2025. Adding age verification on certain applications can also protect the young from being prone to cyberbullying. This way, children can't get on certain sites they shouldn't be on. Lastly, we should start educating children about the dangers of social media. Teach them how to be cautious of who they interact with online. There is only so much we can do to protect our young from these people, but the internet is slowly becoming a safer place every day.
Body image and self-esteem. What is body image? Body image is the thoughts and feelings a person has about their physical appearance. It includes how you see yourself in your mind and how you feel about your body, such as height, weight, and your features. This can be both negative or positive. What is self-esteem? Self-esteem is the evaluation of your own worth. People with higher self-esteem are more confident, capable, and feel better about themselves, while people with low self-esteem are more likely to doubt themselves and have low confidence. Self-esteem is important because it affects your relationships, mental health, and your overall happiness. The effects of social media. How does social media affect body image? Social media affects body image negatively because it creates an unrealistic image of the way people should look. On social media, you're constantly exposed to edited pictures and unrealistic expectations of how you and your body should look. Social media causes you to constantly be comparing yourself to others, and it encourages it. Constant exposure to edited pictures on social media can create negative thoughts toward your looks and can make you feel like you don't look good enough and lower your confidence. How does social media impact self-esteem? Social media has an impact on a person's self-esteem because it causes them to often compare themselves to others online. It can cause you to feel better about yourself based off things like likes, comments, and followers. Positive feedback on social media can boost your self-esteem, while negative feedback can affect your self-esteem negatively. Social media is also fake. The majority of posts only show the best parts of people's lives. This can make people feel like they aren't good enough. Seeking validation on social media. How it affects body image and self-esteem. Social media causes people to seek validation through likes, comments, and followers. Social media has completely changed the way people think, and people are impacted so much by positive feedback that it boosts their self-esteem and makes them feel better about themselves. Social media has completely changed people's lives. People care more about online popularity and likes than their personal qualities and values. People are becoming dependent on what others think of them on social media, and is negatively affecting their body image and self-esteem.
How can we stop the effects of social media? So for this, we came up with two solutions. The first one being enforcing the legal age limit. To do this, we'd have to make apps require documentation of your actual age, and then we'd also have to set an age restriction on technology for ages below 16. The second solution, which is the one we chose, would be to ban social media with the exceptions of apps like messages and calling. Again, you'd keep all apps that had no correlation to socializing online, but ones like Snapchat and Instagram would all have to be gone because they are social media based platforms.
In 2022, an ad hoc committee of the National Academies of Sciences, Engineering, and Medicine began a consensus study to explore the complex relationship between social media and adolescent mental and physical health, and pinpoint research that is needed to more fully understand the impact of social media products on different demographics of youth. While there are many positive aspects of social media, such as their ability to entertain and facilitate important connections, especially for those who may feel isolated, there are also potential negatives we must address as a society to protect our young people.
The committee did find that there are harms that emerge from social media. Those include a threat and the risk of harassment, the risks of people connecting with those who actually want to do them harm, and social media displacing, for example, time spent with friends, displacing time spent on homework, as well as social media then working to connect people to behaviors that are harmful for them. For example, disordered eating. For example, use of substances.
So how do we maximize the good and minimize the bad? The study committee made specific recommendations in their 2023 report to help policymakers, regulators, industry, and others chart a course of action using the categories of design, training and education, online harassment, and research. Those recommendations included a diverse technical working group to develop standards for platform design, transparency, and data use that could form the basis for benchmarking social media companies' commitment to safety and openness.
It is really hard for adolescents and for parents to know which social media platforms are taking the necessary steps to make sure that we have a safe online environment. While we hope that the standards would lead to a virtuous cycle of social media platforms complying, if they do not do so, these standards would also create a pathway to make sure that they are held accountable.
User-friendly systems for reporting, follow-up, and adjudication of cases involving online harassment and abuse.
One of the reasons we need better reporting about online harassment is we need to understand it better as a phenomenon. So, for example, body shaming. Even if you were completely convinced this is a problem and you didn't need to know anything more, knowing how to fix the problem really depends on a better understanding of the mechanisms by which it happens.
Comprehensive digital media literacy education in K through 12 and training for teachers.
We as a country want young people to be educated about the use of social media. And to do it in the schools, you need to make sure that teachers are prepared to teach it. That is not so straightforward. So the committee tried to give some concrete suggestions about who that responsibility lies with, so that this becomes part of curricular training.
A national research agenda that prioritizes the health impact of social media, the epidemiology of problematic use, the role of parents, algorithmic audits, and more.
Social media platforms are changing constantly over time. When they change their web interface or other components, that can break our ability to collect data. Social media platforms have a really tight control over their data, and they use both technical and legalistic strategies to do so. And we need more progress in this space.
Revised FTC regulations that clarify how to make reporting systems comply with COPPA and support and intervention products for youth who experience abuse.
COPPA prohibits the collection of any information of children under 13 without parental consent. This will come as no shock to anyone. Some children who are under 13 lie and get online. The companies who have approved mechanisms for determining the age of children say, we don't have a problem, there are no children online, when on some level we know that's not true. So we have a form of liability. These people who violate COPPA end up having to pay fines and having to bear public criticism as a result of this. Have an incentive to be less than forthcoming and can deliberately not collect information that may obscure our ability to understand what's really going on.
Better access to data for research, including a requirement for providers to remove prohibitions on researchers' use of public data from their terms of service, and relevant legislation to see this through.
In order to determine an effect of something, you want to say, let me see what you were like in 2019, then 2020, then 21, and track over time your social media use and track your health over time. We need quite a bit more research so that we can hone in on what are the elements of social media that may be most harmful or conversely more beneficial.
As the social media landscape continues to evolve, the need for a path forward to assess health effects is clear. Let's empower parents, teachers, physicians, and others to provide the right guidance at the right times.
Social media has transformed the way we interact, the way we communicate, and we think we know a lot of things, but we have to chop a little bit finer. If we were to enact laws that blanketly prohibited use of social media in a wide range of contexts, we actually risk doing more harm than good.
Our goal should be to understand the mechanisms through which the technology affects health so that we can encourage the positive and downplay, mitigate the negatives. And I think the report tries to provide a roadmap for that.